I've been asked about the importance of data sciences, particularly when it comes to health-related activities. And I can't emphasize enough how important data is for decision making. The first use of data is actually accurate measurement so that we know the size and the scale of a problem as well as where it occurs. As an example, if we think about the things that kill children, how do we know what really matters? One of the ways we do that is by being able to both understand the causes of mortality and then digging down to be able to understand what the risk factors for that mortality are. This sounds really simple, but it isn't. In order to be able to make measurements, you have to have the right kinds of tools available, and those tools have to be based on the population. So the first use of data sciences is to have an estimate of mortality. When we know how big a problem is, then we begin to think about the ways in which we can fix that problem. So in terms of risk factors, deciding how to prioritize what to work on, what we can alleviate, is really driven by the measurements that we have made. And then we need to be able to monitor the effects of any interventions that we deliver. When we do that, once again, we need to be able to attribute the intervention's impact by really careful measurement. Data and data scientists are critical in this effort. When I think about approaches that have been taken in the country, we have a long history of doing that in India, starting with the surveys that were set up by the Indian Statistical Institute, which have been refined over time. It's important that we protect these tools, and the work that Ignite is doing as a support system for life sciences is absolutely critical in ensuring that we maintain the quality of the work that is done in India so that we can continue to measure both the size of the problem and the impact that we can make through interventions.